Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Antidotes. Physical or mechanical antidotes. Physical or mechanical antidotes will prevent absorption of the poison. These include activated charcoal or demulcents, which form a thick coating over the gastric mucosa, like milk, egg white, starch, and bulky foods. Chemical antidotes. Chemical antidotes combine with poison to produce harmless and insoluble compounds. For example, copper sulfate for phosphorus poisoning, tannic acid precipitates strychnine, cocaine, lead, nicotine, and tannic acid. Potassium permanganate solution acts on strychnine and opium. Third, physiological or pharmacological antidotes. Physiological and pharmacological antidotes acts at tissue levels and produces the symptoms. And, and these symptoms are actually opposite to those symptoms. Like for example, atropine and physostigmine are true physiological antidotes. Phys- Atropine is an anticholinergic. Physostigmine is a cholinesterase inhibitor. So both these have opposite actions. Like acetylcholine will inhibit, atropine will inhibit acetylcholine, whereas physostigmine will inhibit acetylcholine esterase and thus inhibits breakdown of acetylcholine. So physostigmine increases the acetylcholine, whereas atropine decreases or inhibits acetylcholine action. So these both are true antagonists. Universal antidote. Universal antidote, though the concept is obsolete, universal antidote used to contain two parts of activated charcoal and one part each for tannic acid and magnesium oxide.
thank you and thank you for watching.